Welcome, Dr. Ratush, to our podcast. It's really nice to have you on today.
Yes, very excited to have you on today, Dr. Ratush. Very excited.
Thanks, guys. Sorry for stepping on you, George. I'm glad to be on. It's been a while since the first time I was on, and I'm excited to see what you guys have for me today.
Yeah, I for those of you listening, Dr. Ratush is one of the founders here at SohoMD, and he was a guest on our podcast previously on our very first episode called Meet the Founders. So, today we're going to dive into a bit of a different topic, but if you are curious to hear more about Dr. Ratush and just the start of SohoMD, you can reference our very first episode. And I also want to welcome George, my co-host. Good to see you.
Definitely excited. Yeah, the first one was a little bit more of a back history of SohoMD. Today we're getting into a topic that many people love to discuss and talk about. Sometimes it is a little taboo. So, we're here trying to discuss as much as we can. So the topic for today's podcast is sex, Dr. Ratush. Very excited to have some of your insights let's get started.
So our understanding, Dr. Ratush, is that you did sex therapy for a little while. So we want to know more about that. And firstly, what even attracted you to that field?
Wow, cool. So that's actually more interesting for me than talking about sex, believe it or not. In a sense, because I think throughout my clinical career, I've always been most attracted to kind of the most bang for your buck kind of fields or problems. And when I mean bang for your buck, I don't literally mean bang, and I don't literally mean buck. Even though this is a sex topic here, I'm actually talking about in medicine. There's certain things that you could do very little, and it could go a long way. And there's also opportunity fields where it seems like doctors miss an opportunity to really impact the lives of their patients because they just don't address a certain topic. And the most obvious things for me in my training, in certainly psychiatry and the idea of talking to people as a way of helping them in their lives, it was obvious that the two things that even the doctors are avoiding were the discussions of sex and the discussions of drugs. And so I naturally was drawn to that because I realized that there's going to be just a lack of genuine interested bodies trying to help people in real need.
Yeah, and that is very interesting. I'm noticing how you said like drugs and sex are lacking in. Do you feel like it's just medical assessment in general or specific to psychiatry? Like what did you notice?
Before doctors are doctors, doctors are people. And they avoid the things in their evaluations that they avoid in evaluating in their own life personally sometimes, right? It makes sense. I just recently, a friend of mine sent me an old advertisement from, I guess, maybe the 50s. And it was more doctors smoke Camels than any other cigarette brand. So if your doctor is obese, smoking Camels or Marlboros, is he really going to address those things as problems in the patients he sees or not? And how often? If your doctor doesn't know that much about addiction as an academic education perspective, and maybe is either in denial about stuff that's actually happening in their own family or actually ignorant to what it actually is, how likely are they to explore that? When you ask, I think they did studies like this actually. If you ask general psychiatrists what percentage of their patients have addiction problems, they remarkably give a very low percentage, right? Because they never ask.
Yeah. Well, that's interesting. So, do you feel like it's kind of a population issue in general that people tend to their own sexual health and sex life in their personal life?
Well, if you grew up and sex was taboo for you as a child, and it was kind of taboo in your social settings as an adult, and now you're a doctor who chose psychiatry because you really want to explore people's thoughts and emotions, and you want to help schizophrenics with schizophrenia, whatever that passion was, that's fine. But that doesn't mean you somehow revolutionized your emotional openness to all these things that you grew up being prohibited to explore on a personal level, maybe. Like a person has to, it's not a surprise that there's probably more doctors with a history of addiction in the field of addiction, because otherwise people didn't even get it. Like, we weren't trained to get it. Certainly not from the perspective of how to intervene in a healthy way, you know. And so that's true for addiction, but for sex, it's certainly true. We don't teach uh, young people about themselves in a way that's super healthy. Like, people realize that something needs to be done better, but instead of actually figuring it out better, they come up with one idea and then they politically debate it and then they fight about it. And it's like a bad idea to begin with, but then the fight about it is even worse. It's like, it's important to address that. It's important to figure out how to best uh, have young people come to grips with all the hormones and how it relates to their physical body, how they relate to the physical body, and how that relates to how they want to express it in their lives. Right. And that's like very broad, and that's exactly how it should be. But it needs to be addressed. But as we actually get older and start having relationships, and well, check this out. And this is actually my big pet peeve about probably the majority of telemedicine companies out there that claim to do some good, especially in the field of sex. They're basically glorified pharmacies, and it's really disturbing because from a research standpoint, we've known for over a decade that patients who successfully are treated with Viagra for erectile dysfunction, half of them still stop using it despite the success.
Interesting.
And the conclusion, I think, was pretty well confirmed, that it's because they actually needed therapy. Something else was going on in their relationship that led to that experience. I'll give you a very basic kind of, middle America example. You know, guys that gain a lot of weight and then have erectile dysfunction with their wives. Is it just because they really love beer and food, or are there dynamics? They can't. Men are not really well versed in exploring and talking about their feelings in general.
Right.
Again, that's a
Yeah.
very American thing. Like, men are
Sure.
supposed to be strong and silent,
Right. Right.
right? The same way that we could talk about the pressures of our society for women to put on heels or augment their body into a particular silhouette, or their face bone structures into a particular silhouette with makeup and so on. Men are given certain ideals to pursue as well, physically as well as psychologically and emotionally. And strong and silent is the American ideal for men. And that doesn't really give too much opportunity for men to tell their partners all the ways that they might be dissatisfied with the relationship. And gaining weight and just having erectile dysfunction or early ejaculation, so that you could, and then you could fall into that meme of like, yeah, I have dad bod, and I'm an early ejaculator and I like football. Leave me alone. I have healthy kids. What do you want from me? And it's like such a common story that we should really think about that. That's who all these guys are? Or is that just something that they're willing to take on as an identity because of their inability to express what they're actually feeling as men and in a relationship with their spouses, as fathers, as trying to be providers in regular times as well as COVID and post-COVID times.
Yeah, yeah, and I think I know you're speaking about men, but I feel like women might be able to resonate. Maybe they're not having erectile dysfunction, but libido decreasing for whatever reason. You kind of touched on that too, like needing to be a certain way, look a certain way, present a certain way, and it clearly is something that affects men and women. And as you were explaining this, I was thinking about my next question, which is, what is sex therapy? Like, what do you dive into? What does that even look like for somebody to engage in therapy around sex?
The truth is, it follows the same rules, I think, as all psychotherapy. You go to where your patient is. Why are they coming in? What's their acute problem? Maybe there's an underlying problem. Maybe part of the problem is their lack of insight into the connection of the underlying problem and the acute presenting problem. And maybe that's where the therapy is. Maybe it's more directive. Maybe it's more supportive. And oftentimes it involves a partner participant.
So, let's say you're treating a patient for sex therapy, and you're bringing their partner, and you guys are discussing. What are some topics you're discussing? Are you discussing like performance, intimacy, desire, fantasies? Like what are the discussions based around with the partners involved?
Bringing in a partner for some things could be really impactful. Many, 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 many years ago, I was working with someone who, like many men, complained of early ejaculation. And there's like an official definition is under 2 minutes of intercourse. And this particular person, has a family, has a wife that he says is super satisfied. She never complains. But yet he's there and he's exploring this. I give him a bunch of different things to try, together with some medication support. Apparently she's down. He could do whatever he wants. Very supportive partner. Never really followed through with anything. He was there, but he wasn't there. He had a problem, but he didn't have a problem. She was supportive, but he never wanted to bring her in. He was almost ambivalent about every aspect of why he was there. So whether or not, it's a young person who's, let's say, has icky feelings about touching someone else's genitals, and just the thought of having to touch them is anxiety provoking, where they lose their sense of arousal. So now they're kind of asexual. But are they asexual? Should we have a designation for it, right? Or are they asexual as a response, to this profound anxiety associated with some irrational germ theory idea that they have. So sometimes it's something like that. Sometimes it's because you're in a relationship and one partner wants to have sex and the other one doesn't. And you realize that sex is the least of their problems, and there's a lot of other things going on, but they're not discussing any of those things and fighting about those things, so all of it just comes out through the way that they do or don't have sex.
You often were encountering men who were dysfunctional in some way. They're pre-ejaculation, or they're having trouble with their libido, and I immediately was thinking about the porn industry, actually, because a lot of, I mean, I'm a woman, so I don't have a male sex experience, but the way that I've kind of understood sex in our culture is that it's kind of heavily influenced by porn. Most people are exposed to it at some point in their life, and it's got this very hypersexual for the men, hypersexual for the women, for performative. Like there's this whole picture of sex that's painted through porn, and I'm just curious, given like what you've seen, and I guess my question about how does the porn industry, how do you feel it affects people's sexuality and how they relate to sex?
I think what you're referring to is that we're kind of living in an era of performance, a performance in everything, peak performance in everything, peak performance in health. People are interested in longevity. How do we live forever? How do we go to the furthest part of space? It's like pushing boundaries. It's individual achievements. It's all this type of individuation, in a sense. And pornography amplifies that signal. But and there's plenty of people out there that have porno quality sex at home. These people do exist, but they're not everyone. And the fact that that's out there, well, I think certainly young people take it in stride with everything else that's exaggerated that way. For a lot of people, considering how limited sex is in terms of discussion, and how puritanical our U.S. society is by historically,
Yeah.
not judging it, it just is, it just has been, that I think for many it's been more good than bad to have that kind of exposure sexually. Like it's not an uncommon thought by many older guys that, man, if I had seen porn when I was a teen, I could have really had a good time. I didn't know enough to appreciate my opportunities. And now I'm whatever, 50, 60, 70 years old. And, I'm never going to have those experiences. So that's there. Are there people addicted to it? Of course. Oh my God. It's so much easier to just be, locked in your own room masturbating all the time. That's kind of, but then again, is that a porn creation, or is porn just a part of everything else that's facilitating that? Like Amazon's facilitating it, Uber Eats is facilitating it, work from home option is facilitating it, So is it just porn that's doing it? I don't know. I don't think it's fair to just say it's porn, but are there clear examples where people get so uh, drawn to a pornographic ideal that they have divorced, to use a loaded word, themselves from realistic human relationships and how sex would actually work with someone that you plan your budget with, as opposed to, this weird fantasy that you saw 3.5 minutes of in the bathroom,
Right.
you know.
And like
Um,
what is realistic? Like what can somebody, because I think, there are many people who don't have, I don't know if realistic is the word, but like a norm of some kind. Like what does normal, healthy sexuality look like?
I think it could be anything a person's comfortable with, right? I think normal sexuality could be asexuality. It's how you relate to your sexual life and how it impacts the rest of your life. And is it a distressful relationship or one that brings you comfort? If a person finds comfort and stability and security and confidence in not having sex, I would say they have a very healthy sexual life.
Mm,
We're not all built the same, and we certainly don't relate the same way to even how we're built. And there's many factors that then get added to that will change the course of how we want to act in the world that we're in. Sexuality and how we act out sexually is just one facet of that. And it makes sense for it to be as diverse as everything else that we have right now.
So I got a couple of questions for you, Dr. Ratush. Some fact or fiction, just from your previous experiences in the field, kind of let us know what you think, fact or fiction. So there's been many studies on this particular topic, but some recent studies have shown that men think of sex twice as much as women. From your experience, fact or fiction?
Yeah, probably fiction. I think biological differences exist, hormonally and so on and so forth, between like the binary gender types, right? Like, but I think we might not capture the ways in which women's lives are sexualized for them, or they might not report it because of certain even social pressures to kind of almost underreport feeling sexual. Um, and there's so many reasons that could impact that type of like fun culture study. Um, we're biological creatures, and we all respond to certain types of biological cues. And certain one of the cool kind of studies that show that is when showing kind of pornography to uh, um, men and women, everyone was aroused by everything. So they actually measured arousal. Everybody was aroused by everything. So if they watched gay porn, straight porn, animal porn, any kind of sexual activity aroused every single human being that watched it. But heterosexual men refused to report that they were aroused by any homosexual sexual activity on the screen. And it's like, so it had all these types of cultural answers about how we see the world, but how we actually biologically see it, our bodies respond to all sex.
Perfect, perfect. Next question, Dr. Ratush. Steve Carell famously said in The 40-Year-Old Virgin, is it true that if you don't use it, you lose it? Fact or fiction?
Kind of fact. What happens when you have a cast on? That muscle atrophies pretty quick. 6 weeks later, and you're not the same. The good news is it'll come back relatively quick too. With sexual stuff, yeah, I think for both men and women, those organ systems need to be kind of like, you know, they need a tune up. They need to, you got to fire the engine and take it around the block a few times. But you can get it back.
mm.
And
Yes.
to what degree has to do with who you were before you lost it. And did you turn it off yourself or other, there's factors.
Perfect. Aphrodisiacs work. Is that fact or fiction?
MDMA certainly seems to do an interesting job at that. Um, I would argue that there's probably some mushroom cannabis mixtures that could probably do things like that. I would argue that some psychiatric medicines, when you mix them, could have that effect. Um, so it's doable, but it's never going to be as strong as the person actually. Like when you're turned on by someone because of who they are as a human being, and when you connect that to their physical, and then you connect that to your physical and to you as a human being, that's going to always trump the type of gas station aphrodisiacs, you know. But yeah, there's probably many.
Perfect. Perfect. And the last one that I have, fact or fiction, a good sex life promotes a healthy heart.
So right, but that's like so I don't know if you're talking about like is it the orgasms that do it, right? Or is it the cardiovascular benefit, right? You know, there's a most people who have sex will race their heart a little bit. So most people also don't have cardiovascular exercise routine that they follow. So if they only have sex, but they have sex regularly and they have a sex life that lasts anywhere between 5 and 15 minutes, 2 to 3 to 4 times a week, an argument could be made that it's heart healthy, right? Um, but yeah, look, an active sex life means you're actively moving around in non-linear, like walking, sitting kind of ways. That's probably good for your joints. It's a type of partner yoga of sorts, or like wrestling of sorts. Like grappling. So like that's probably good too. Look, it's good to spend time with people you care about, and sex is also a version of that. You know, one of the more memorable things for me out of our internal conference that we had with Dr. Milstein was when the term sex, skin hunger, and I really kind of related to that idea because I don't know if I've had sexual relationships with people just for skin contact, but I certainly like the idea of being touched, getting a massage, uh, you know, being pat on my back. As a child, I would sit under my mom's feet, and she would just kind of scratch the top of my head. I just needed some kind of contact, and that's a physical version. But there are many relationships where outside of the bedroom, that might be the only intimacy. And people need intimacy, maybe more than they need sex, you know? So maybe that's kind of what I'm really here to say.
I think that was very well put, Dr. Ratush. I learned a lot today. Erin, how about you?
Yeah, I think, it's I wasn't quite sure what to expect, but I feel like it's I got something out of it in terms of just the more complex layers of a person's sex life, and like some sense of normalcy, and then some sense of like, a lot of people go through these different issues around sex, and that it's like, yeah, it's normal, and then also it's not as intimidating as I think many people might assume. So I really appreciate you coming on today, and maybe this is the start of like another episode. Maybe we can have a couple more to dive into this a little bit further and talk about more specifics. But yeah, thank you so much for coming on today, Dr. Ratush. It's been a pleasure, and thank you, George, for co-hosting with me today.
Thanks, George. Thanks, Erin. It was good. I also did not know what to expect. I'm glad that we didn't put too much pressure on ourselves. And yeah, it was a good time. Really appreciate it. Thank you, guys.